Thank you. Wow. Thank you. Thank you. Thank you all. Thank you, thank you. Thank you. Wow, what a welcoming. Listen, you guys up here, you're just fabulous. Thank you all very much. For those of you here today to participate with us, thank you all. And thank you, of course, for that very nice welcome. I know it wasn't just for me, it was for all of us in this room that have worked so hard. But I want to thank you today for being here on truly this very historic day. In a few minutes, I will sign into law legislation that extends cost-effective health care to hundreds of thousands of Arizona's working poor, our friends and our neighbors in need. This legislation will protect Arizona's hospitals. It will create thousands of jobs, and it will save lives. First, I want to recognize the lawmakers who made this moment possible. They displayed something we don't see a lot of in politics today, and that is courage. Standing with me is a coalition of legislators from both chambers of both political parties. You've accomplished in Arizona what the political commentators and experts just months ago said it was impossible. You stood firm with me on behalf of the state you serve. You put people before politics, and you stayed strong in the face of personal attacks. For that, the people of Arizona are grateful, and you have my utmost gratitude and respect. When I announced my Medicaid restoration plan in January, I knew the road ahead would be rough. I knew I had not chosen the easy path. But I learned a long time ago that what is easy and what is right are rarely the same. Well, today, I know in my heart that we have made the right choice. I know because of the outpouring of support we have received these past 5 months, most especially in the days since the legislature cast its critical votes for this measure. More than 400 community groups from every corner of this state have joined our efforts. We've heard from doctors and nurses who daily see the human impacts when Arizonans without insurance are forced to use the emergency room for primary care. We've heard hospital executives describe how spiraling costs of uncompensated care are pushing their institutions to the brink. And we've heard from business leaders like those with me today describe how all of these costs are being pushed onto employers and Arizona families in the form of a hidden health care tax. Most of all, we've heard from regular Arizonans. You know their stories. The single mother who credits access with saving her life from breast cancer, the hemophiliac who depends upon access for his life-saving medication. Here's a story you may not have heard. In March, in the House Appropriations Committee, they held an informational hearing on this issue, and a young woman stepped to the lectern. She was a senior at ASU, and she said that she had been diagnosed with an autoimmune disorder. Without the proper treatment she received because of access, she would go blind. She told the legislative panel, and I quote, "Access has been my lifeline, and it is the reason I can see all of you now," end of quote. Thanks to the legislation I'm about to sign into law, she won't lose her health coverage at the end of the year, and neither will 63,000 other Arizonans whose access membership would have expired without legislative action. For these Arizonans and so many others, I am now proud to sign this measure into law. Now, because this is such a big day, I know that some of the legislators that are with us and others that made this possible today would like to say a few words. So if we could, maybe we start with you, Steve, if you would like, to hear your comments. And
Thank you, Governor. Thank you very much. Thank you, Governor. Thank you very much for your leadership and your courage. That didn't take any courage on our part. This is our job that we're supposed to be doing back here. But thank you to all the legislators that voted for this, that helped on it, helped push it through. It was fantastic the other night. By the way, this is a much nicer crowd than I was accustomed to on Thursday night. And it wasn't Medicaid that brought it up, but I don't even remember what it was. But this is the right thing to do for Arizona. I worked hard on it with the governor. I can remember one press conference when I was the only Republican standing out there with her. And I'm proud that I was there because it is the right thing to do, and I'm glad everybody's joined in here and said so. It's the right thing for rural Arizona. My hospital was about to go under. There are hospitals that did go under in the White Mountains, and this will help. Rural Arizona has been saved, and it's just right for everybody. It's the right thing for all of us. I couldn't imagine booting 10,700 vets and their wife off of any kind of health care January 1st of next year. There are things like that that are horrid that we just had to solve, to save them and do the right thing. The coalition that we built, I'm proud of them. We've been blamed that this was the total budget was a Democrat budget, and how could it be? You know, we work together. It's Republicans and Democrats. There was $100 million that is $100 million less than the original budget that was produced. So we worked hard. We cut things. We did everything the right way, and I'm very proud to be here. It's a shame that those that disagreed with those of us up here are so disagreeable. We're getting used to it, but I wish I could tell you a couple of the emails I got. They'd make you laugh harder than you are, but it is. It's a shame that that you can't disagree honorably and still have a discourse, and that's important. That's one thing that's lacking, I believe, in our legislature, is that we need to have more civility. We need to have more respect for the institution, and we need to have more respect for each other, and that's been gone down there. It has left. But we're going to get it back with the leadership of the governor here, and with great things we've done like this. There's going to be more next session. I hope none before next session. but there might be. There might be. So anyways, I've been a Republican all my life. I know one of my colleagues said he'd been a Republican all his life, and this one vote, he has Republicans calling him everything but a Republican. And it's just a sad sight that it's like that. So I'm proud we did this. I'm grateful for the 250 to 350,000 people that are going to now be covered with health care. I'm grateful to everybody out here that did the work. I see people out here from John Arnold. I see Jaime over here that did so much work on this. And I can't start naming names or I'll forget somebody. I already forgot a couple here. There's one going to speak. So I'll thank them later. But thank you very much to all of you. Great job. I hope we do this more next session. So thank you, Governor. Thanks for your leadership.
Good morning. Well, first, I have to absolutely say thank you to Governor Brewer. You have been heroic and, even more importantly, a rock star. And thanks to your determined leadership, we will provide health care to hundreds of thousands of Arizona's most vulnerable citizens. And this care will not be in the overcrowded hospital emergency rooms, but in clinics and doctors' offices and community health centers across our great state. This is cost-effective medicine at the right time, in the right setting, saving money and saving lives. It's a historic achievement and the honor of a lifetime to be by your side as you make it the law of our land. And as House Health Committee Chair in the House of Representatives, I have been brought to tears by the courage and the dignity of the hardworking men and women who have shared their personal stories of disease and devastation, all to advance a cause larger than themselves. Thank you to every patient who wrote a letter, made a video, or gave a speech. And thank you very much for braving the political arena to help us all see the impact of our decision through your eyes and your experiences. You know, the governor calls our access program the gold standard, and she's absolutely right. If the rest of the nation were following Arizona's lead, healthcare in America wouldn't be such an expensive mess. And thank you to the incredibly dedicated people at Access, the private sector health plans they partner with. And just to be perfectly clear, we do not have a government-run healthcare program. What we do have is 30 years of evidence to show we have found a better and more cost-effective way to serve the healthcare needs of our most vulnerable citizens. And we will bring healthcare innovation to a new level with enactment of this program. So to my 8 brave Republican colleagues in the House, I want to mention them by name if you don't mind. Kate Brophy-McGee, Bob Robson, TJ Shope, Ethan Orr, Doug Coleman, Jeff Dial, Frank Pratt, and Doris Goodale. Thank you again for your leadership and your courage. And to the entire bipartisan group that stands here with us today, we are honored to serve with you at the Capitol. And finally, to the broad array of business leaders and organizations who committed to make this happen, like my colleagues, the Arizona Chamber of Commerce and other business organizations, understand that fulfilling our legal responsibilities is also good for the economy. It creates jobs and saves businesses millions of dollars. You were by our side with help and support each and every step of the way on this difficult journey. It was an unprecedented partnership, and we are enormously grateful to you. And with that, I thank you, and we'll continue with our celebrations with Senator Landon Taylor.
Thank you, Representative Carter, and after my many years in the legislature, I now need readers, so here we go. But I'd like to start this morning by thanking our governor for her tenacious leadership on this critical issue. I'd also like to thank my good friends on the other side of the aisle who had the courage and the fortitude to stand up to extraordinary, and emphasizing that word, extraordinary pressures from members of their own party to do what's right for Arizonans. This is a shining example of the good that can come from bipartisanship. And of course, I want to thank the Democrats in the House and the Senate who reached across the partisan divide and stood together with unwavering fortitude, because we believe truly in finding common sense solutions to the challenges facing our state and working across the aisle with whoever shares that vision. And that's exactly what it took. And on this issue, Governor Brewer certainly shares that vision. Her leadership in crafting and passing this historic legislation was certainly challenged, and her patience, it might have even been tested through this process. However, she ultimately prevailed, and more than 300,000 Arizonans will live better lives because of her leadership and her vigilance. While some have only focused on the politics of this, I want to focus on the policy. What has been signed today was historic in its scope and impact, and is truly the right thing for the people of Arizona and the future of our state. This legislation will save money, and it will save lives. Governor Brewer knows that. My colleagues on both sides of the aisle know that, and the people of Arizona certainly know that. Working together with members of both parties and the governor, we were truly able to achieve something very special. And I certainly want to thank my leadership team, Senator Linda Lopez, and Senator Ana Tovar, and those members from the Senate who worked so hard for this. Senator McComish, Senator Worsley, Senator Driggs, and Senator Pierce. And all of our other members who supported this in the Senate. Let this serve as a friendly reminder that bipartisanship can work. This was an example of that. It can work for the people of Arizona. It now gives me a true pleasure to bring up my colleague on the other side of the House. Someone told me today, you're in charge of Chad Campbell. I'm like, thanks a lot. So I would like to bring up Chad Campbell to say a few words.
And I want to thank everybody for being here, and I want to point out who at the beginning of the session would have thought that not only would I be getting one pin from the governor, but 2 pins from Governor Brewer now this session. And yes, I have been. Thank you. You're right, I have been. Thank you. All right, touche. And I bring this up, though, and the governor makes a very good point, but I bring this up. You and my wife should get together, Governor Brewer. Because at the beginning of the session, if you remember, we stood in this room after the first week of session as the governor signed a piece of legislation to fund CPS and make sure we had more caseworkers to go in and help out the children across the state. And that was due to another bipartisan effort where we put aside politics, put aside the rhetoric, and work together to get something done in a very quick manner. Now, Medicaid took a little bit longer than the CPS did, but we got there because we put aside the politics again. We put aside the rhetoric, or at least some of us put aside the rhetoric, I guess. Others didn't. But the people in this room today, the people who supported this, did just that. We did what was right for the state. And it's been a very good session. I've been in the legislature for 7 years, and I have to admit, this has been the best session I think I've been a part of for many reasons. For the fact that I built relationships with many of my Republican friends that I think will be lasting, and not just personal friendships, but political friendships, and I think that that means something. And as Senator Pierce and others have pointed out, we've lost track of that, and we need to get back on track with that. But it's been a challenging session, and this issue in particular is probably the most challenging issue I've worked on. It was one of the boldest things I've seen. The governor coming out on day one was immensely exciting for all of us on the Democratic side of the aisle, and we wanted to be there for you from day one, and I hope we were, Governor Brewer, and I think we got that done because we worked together. But it was also the most gratifying thing in terms of what was the outcome, and that was passing Medicaid, that was getting CPS fixed, that was putting together a budget that was a budget for the state of Arizona, the real people's budget for the state of Arizona. I want to point that out. This is a budget that does everything we need to be doing. It does it in a very common sense way, and it does it in a fiscally prudent way where we're investing in not just the short term, but the long term as well. And that could not have happened without the leadership of Governor Brewer and my Republican colleagues standing here today, so I thank them for that. And the last thing I will say, and then I'm going to hand this over to somebody else, is over the weekend I got so many calls from people saying, how does it feel to be a winner, actually? And it was good to hear that, but I do want to point something out. The winners of this debate are not Democrats, it's not Republicans. The winners of this debate are the people of Arizona. The hundreds of thousands of people that are going to get health care, the thousands of jobs going to be created, those are the true winners. And it would not have happened if we hadn't all gotten together and done this, and without the leadership of Governor Brewer. So I want to thank her again for doing all of this. And I'm going to hand over to Glenn Hammer, but thank you, Governor Brewer, for everything.
Thank you, Representative. And the first thing I need to say is thank you, Governor Brewer, for your extraordinary leadership. If they make issues any tougher than this one, please pass over Arizona next time around. This governor, throughout her entire time in office, has taken on the tough issues to do the work of the people of Arizona. From the get-go, the entire business community was united behind Governor Brewer. Almost all of the major chambers of commerce and economic development organizations strongly supported what the governor put forth a number of months ago. I want to thank Jaime Molera for really doing a phenomenal job of bringing the entire coalition together so we could eventually get to this point today. So why was essentially the entire business community behind this proposal? Well, the business community, over 120 major chambers, economic development groups, and prominent CEOs were behind this because the issue of uncompensated care is a real issue. We need to have a healthy hospital system, and hospitals across Arizona have been feeling the stress of a surge in uncompensated care over the years. And we heard stories earlier today of hospitals closing or hospitals reducing services, and that hurts all of us. So we needed to do something about this. This plan that the governor put out was easily the most cost-effective way to also do something else that was important, and that was to make sure that the wishes of voters who have twice passed legislation, or excuse me, an initiative saying that all childless adults should be covered, were covered. This was the plan that made the most economic sense. This was the plan that provided the coverage to those individuals. This was the plan that did it in a way that also protected the state's budget. We're right now in a great shape as a state. Thanks to the governor's leadership over the years, we're surging every economic development indicator from every major organization is going in the right direction. Her signing this legislation will help us continue to move forward economically. It will provide coverage to our people, and it will be something that the people of Arizona will benefit from generations to come. Governor Brewer and all of the legislators here, particularly those who took a pretty tough vote, thank you for your efforts. And I apologize for not being polite, my colleague from the Hospital Association, Greg Victor.
Thank you, Glenn. So it's kind of amazing. 5 months ago, I was sitting in my living room in Seattle, Washington, minding my own business. And 5 months later, I find myself here in Arizona, part of this great celebration. But let me tell you a little bit about the conversation that was going on in that living room. It was with my friends, and I was explaining why I was going to be uprooting my family and moving down here. And the biggest part of that conversation was about this issue. I shared with them how I picked up the paper early in my conversations with my new organization and saw the governor in a photo with many of the people on this stage saying, we're going to do this proposal. And what I shared with them was I saw a great opportunity to do something really significant in terms of health policy for the people of Arizona, to be sure, but also for this nation. Let me explain a little bit about what I mean from that. What I was doing up in Washington, what Washington State is doing is implementing Obamacare. And that's what I was doing. I wasn't really happy doing it. And so for 4 months, I've been listening to the opponents of this say that's what we're doing here. The opportunity I saw was for this state to grab a hold of some of the potential, the good things in that reform law, but really cast its own future around healthcare delivery and financing. That was the opportunity that I saw back then. That's why I wanted to be here, to be a part of it. And it is just freaking amazing to be here, not just talking about the opportunity, but the achievement now. I'm just proud to be able to say I was a team member on this, but I really stand in awe around the leadership and organization that was brought to bear on this, starting, of course, with Governor Brewer. Her persistence and energy is just amazing. The legislators on both sides of the aisle who stepped up to do this, the coalitions that were formed, Glenn and the Business Coalition, Chuck, Peter, what you did with another great coalition, the hundreds of organizations, many of you out there today, the thousands and thousands of people who stood up and said, this is the right thing to do, and by God, we're going to do it. I did want to give a special shout out to the hospitals of the state, not just because I represent them, but because we were the only group that had a special place in this because we had to agree to a hospital assessment to finance it, to make it go. And again, I've been reading a lot about this issue from all sorts of people who are not in the rooms. I know I was in our boardroom. I've been in some of the boardrooms of many of our hospitals, and I know the conversation that led to virtually every hospital in this state supporting it is not because of the numbers, it's because of the people. That this is the human thing to do, this is the moral thing to do, this is what's right for the people and the patients of Arizona, and that's why we got behind this proposal, and we're so proud to be part of this celebration. I look forward to working with all of you, Governor, in the next leg of the journey of doing health reform the Arizona way.
Lose it. Well, I thank you so very, very much, all of you that made a few comments, all of you that are here today, standing up here with me, and those out in the audience. An opportunity like this doesn't come very often, and I hope less in the future, because we knew it was going to be very, very difficult. But you know, when you get of like-minded people knowing that they're here and they're working for the benefit of the people that they represent and for the people that live in our great state, good things can be accomplished. And I think by my signing this bill today, and by all of us standing tall and working hard together for the last 5 months, who's counting, we were able to get it done. And it really, really makes me proud to be here today with all of you. I look and I think I know a little bit now more about each and every one of you, so many of you in the audiences, and certainly out there in the business community. We thank you. We thank you for your support. We thank you for your help. And we will tell you that we will continue to work in a good manner continually for the people of Arizona. Thank you all for being here today.